At Arizona Chiropractic Center, here's how we're going to work on your hip pain. So we know that you've been looking for answers because you found our website, so I'm glad. So the way we start is we start with, first of all, you call our office and you make an appointment with our incredibly friendly staff. Then from there we end up having to do a consultation, right? Because you want to find out what's going on with people. History, detailed exam, detailed consultation. Then following the consultation, we'll do a postural exam. This all happens in here. We'll do a orthopedic exam, neurological testing, and after that, x-rays, because we don't want to guess. We don't want anybody guessing on us, and we won't guess on you. So after this first day of gathering lots of information, we want to find out exactly what needs to happen next. So after the doctors figure out exactly what's causing your hip pain, we'll schedule for day 2, and then we're going to go over all the findings or reported findings. Now, after that happens, let's pretend that today is day 2. So now we start treatment because we want to get to the root cause. We don't want to just treat symptoms. The medical community does a good job of treating symptoms. So if you just want to treat the symptoms, that's one thing, but you're calling our office for a reason. Let's get to the root cause. So after we've looked at the x-rays and we know exactly what's happening, we know how to fix it. So there's one of the main ways that we treat lots of different pains and conditions in this office is this cold laser. The Orconia Cold Laser is the tip of the spear of having modern technology heal you from the inside out. Now, depending on what's going on with you, we'll start with something called an Arthrostim. This Arthrostim we can utilize to make the cells of your body, particular cells called mechanoreceptors, adapt to a better position. So it helps relax the muscles, it turns off spasm, and it feels really good. Another thing we'll use on this hip is called a Vibracussor. This percussion and vibration on the hip joint feels wonderful. It restores range of motion, and sometimes you don't need a big adjustment. Sometimes an adjustment is not necessary, even in a chiropractic office. So if you don't need it, you don't want to do it, but sometimes it is. Now, how do you get this way in the first place, right? Oh, we'll talk about that as well. So this hip joint is going to compensate for joints that are not moving properly. So the sacroiliac joints can be adjusted on this table. We can adjust it on the side, over sideline, like a typical chiropractic adjustment. Our adjustments are very specific. So now, let's say you've already had that done in here. You've already received your spinal adjustment. Now we can actually adjust the hip itself. We feel for the range of motion. Is it stuck? Is it moving really well? Or is there a position where it's not moving well? So we're going to demonstrate a hip adjustment. So we get to where it needs to be and a quick little drop, and it feels great and it frees up that range of motion and you are back to moving again. So let's show you over here what this looks like on an x-ray. So there's a low hip, there's a high hip. And when you see the high hip, very often the high hip is the one that degenerates more quickly than the low hip. So we, again, want to find out, because we don't like guesswork. We're not going to guess on you. We don't want anybody guessing on us. So let's show you some other therapies that we often use to heal people more quickly. So we showed you that laser. There's another laser called the FX405. My lovely wife, Dr. Diane Koch, has come over here and she's on the FX405 already. So one of the great benefits of this laser is there's multiple heads. They are very adaptable, and it's going to get the front of the hip, it's going to get the back of the hip, and it's going to get the side of the hip. So if you have bursitis, if you have hip degeneration, osteoarthritis, also labrum tears, there's a lot of things that you can still do to help somebody's hip. Let's say your hip is so bad and you're really afraid and you don't want to get adjusted and you don't want any sort of touching on it. Completely passive. It's a very wonderful therapy, and a lot of our elderly people in particular who have like pretty chronic hips, this is a favorite. So let's show you the next therapy that we often use. It's called shockwave therapy. Shockwave therapy is not a shock, it's a sound wave. The sound wave comes out of here. It's not ultrasound, doesn't create heat, but that shock wave, that sound wave, goes deep inside your hip, up to 2 inches, 55 millimeters, and all those tight spots that are keeping you from moving properly, you know, the reason why you've been limping for so long and feeling so crummy for so long, this is going to help free those up so you're going to have better range of motion and feel great again. That is, we have 2 of those units in our office because it's one of the fan favorites. Everybody loves that therapy. So much that we needed 2. Now here's a really sneaky little cause for your hip pain that a lot of people don't realize they have going on because their feet feel great, they feel wonderful. It's my hip, it's not my feet. But it turns out so many times it's a foot problem. If you have, everybody has 3 arches per foot. And if your arches have dropped, that's gonna change the position of your hip. And with that change of the position of your hip, you slowly wear yourself out. But it's very slow. So this machine, we have it's a 3D digital laser foot scanner. It tells us with great detail how your hips or how your feet are affecting the rest of your posture. Fantastic machine. The last therapy that we're going to demonstrate for what we could be using to get rid of your hip pain is called pulsed electromagnetic field therapy, or PEMF. Our office has been using PEMF for one of the first people in Arizona, many years. And we have 3 of these units in here, the most powerful units you can get. So what it is, it's an electromagnetic impulse that is passing through there. And whether you're lying down or seated, there's a lot of different ways we can apply this to the hip. But when it's on you, it draws oxygen and nutrients into your hip and it heals you from the inside out. It's sort of like a garden that really needs the water and the nutrients and the fertilizer. That helps you get all of that deep down inside. No needles, no drugs, no surgery. So we have a lot of passive therapies in here. So if you're concerned, I don't want anybody messing with my hip, but my hip hurts so bad and I don't want a hip replacement, call our office because you're in the right place. So give us a call, schedule with our friendly front desk, and we look forward to getting you back into your life again. Give us a call. We'll see you soon. Thanks.